Good morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. All right, we've been talking about a lot of risk in retirement. Now we're getting into one of the big ones that you're going to have to make decisions about, and this is healthcare costs. And this is one of the biggest risks. This can be hundreds of thousands out of pocket after what Medicare covers. Okay, so let's talk about the decisions you're going to have to make with regard to Medicare. Now, maybe you're already retired. Maybe you're already, in fact, receiving Medicare benefits. You still have open enrollment periods where you can make changes and things to that. So this can still be a value and benefit to you, not to mention how you cover those costs, making sure with regard to how you're invested, what kind of income you have, how you can make sure that you can still cover your health care costs, still be able to get the care, of course, that you need without having to worry about running out of money. So still, this is going to apply for everyone. All right, healthcare cost dilemma. All right, this is one of the areas. Healthcare spending has far outpaced inflation over the last decade. All right, you're talking about an inflation rate on healthcare of 5.8%. Okay, that's more than double the rate of inflation at 2.3%. Okay, now here's what else we found. And this is a survey that was done by the Employee Benefit Research Institute. One of the things with healthcare costs, it can have a significant impact on your finances. 38% of people surveyed have difficulty paying their bills. 27% use up their savings, end up without any money, and 16% in fact have to borrow money in retirement just to cover their healthcare costs. This is a dilemma. Okay, the retirement, we're going to show up a chart here. This is a percentage of private sector workers employed by establishment offering health insurance to retirees. See, this is one of the areas, right? Used to be you would retire, just like with pensions, you'd have a pension and you would have health care coverage through your employer. But as you can see by the chart, that number is dropping off dramatically. Fewer employers are covering retiree health insurance. In addition, the retirees who are covered by employer plans face raising premiums, higher out-of-pocket expenses, and stricter eligibility requirements. So many employees are not obligated to continue health care coverage, so sometimes they just drop it if they increase the cost for the retiree, or they end up dropping it altogether. So this is one of those areas, and what do you do? All right, because this is one of the ways that we used to be able, okay, in the past, maybe our parents or our grandparents, right, they didn't have maybe those same concerns that we're going to have in retirement today. So one of the things, the next slide is, this has to do with consumer estimate of annual health care costs in retirement. And this is the part where people don't, most of the people that I see, in fact, that come in don't really recognize just how much health care is going to cost. And when you look at it, 68%, in fact, according to a nationwide study, 68% have underestimated or don't know what their medical costs are going to be. Okay, so you're looking at only about 20% of people, in other words, actually recognize that they're going to have significant out-of-pocket costs in retirement. So let's look at, what about Medicare? Let's talk about myths and facts. So on the next slide, in fact, one of the things you see, one of the myths is that Medicare will cover your medical most or all of your medical expenses. And that's just a myth. It doesn't happen. The fact is, it covers only about 62% of those out-of-pocket costs. Another myth, Medicare will cover my long-term care needs. Medicare does not cover long-term care. Okay? This is so important to understand this. All right, you can get very minimal coverage with regard to, maybe 90 to 100 days. This is not long-term care. This has to do more with therapy type things, with rehabilitation from surgeries or strokes or that kind of thing. This is not covering your long-term care needs. So one of the things, if you understand then how Medicare works and understanding health care, the next slide will be health care expenses. Medicare cost sharing provisions about 45%, premiums to Medicare Part B and D 32%. So this is breaking down your health care costs. Nearly half of your expenses of Medicare cost-sharing provisions, such as co-pays, deductibles, premiums, and out-of-pocket expenses not covered. And estimated that, again, for a couple retiring now will need somewhere between $250,000 to $400,000 to cover the out-of-pocket cost. All right, so let's go now to the next slide, understanding Medicare. We're going to talk about the options here. This is where it gets down to the choices you're going to be having to make when you retire. So option one, you have original Medicare, Part A and Part B. So Part A, everyone gets. That's hospitalization. There's no premium to be paid for that. There still are going to be some out-of-pocket costs potentially. Part B, that's your outpatient cost, okay? Here again, now you're going to have a premium, and that premium you're going to have to pay can be deducted, for most people it's deducted from your Social Security income. Next is secondary insurance, such as a Medicare supplement plan, and of course you may want prescription coverage, and that's your Part D. That also has a premium cost to it. And then there's another option, this is called Part C, or Medicare Advantage plans, which can cover all of those, hospitalization, medical, and prescription, though again you're still going to have potential out-of-pocket costs, and this is where the shopping comes in. So let's break it down a little bit. Let's look at the next slide. Understanding health care. Option one, let's say Medicare Part A. Okay, this is your hospitalization insurance. So day 1 through 60, right, you've got a $1,280, no premium cost, so it doesn't cost you anything for this. But what happens if you go in the hospital? Well, for day 1 through 60 in the hospital, you have a $1,288 deductible. You have to pay the first $1,300. Day 61 through 90, $322 per day copay. This goes into skilled nursing facilities, okay? Home health care, again, $644 per day copay. Hospice, and this is only in that, once you get past these days, okay, that listed in the chart, there's no coverage after that, you're on your own. Hospice, all costs. So other than the hospitalization part, that deductible that you have to pay, you've got coverage for that, but again, the potential out-of-pocket cost, depending on what kind of care you're going to need, can be quite significant. All right, the next slide, we're talking about Medicare Part B. This is your outpatient for your doctors, providers, that type of thing. Preventative benefits, durable medical equipment, outpatient services. So here you're going to have a monthly premium. Now it's based on what's called that MAGI you see, that's modified adjusted gross income. So there's a formula that they use based on your income as to how much your premium is going to be. For most of us, that's going to be at about $105 a month. But if you make, and you're in higher income levels, you can see 2-3 times that amount that you would have to pay in premium for Part B. And you're still going to have that $166 deductible. You're still going to have a 20% coinsurance on doctor services and outpatient care. So the next part comes into how do I cover that? And again, we get into those premiums on the next slide. Is actually going to show you your Medicare Part B monthly premium. So on this one, let's take a look at the next slide, Courtney. And this is where we break out, for instance, on that $85,000 or less, if what you're going to pay that $105. If you make up to $170,000 for filing joint tax return, single individual, in other words, $85,000 for joint, $170,000, $104, $105, and then you can see as your income goes up, your premiums go up to as high as potentially for those making over $200,000, $389 a month. That's relatively new, started back in 07. So that's one cost that we all are going to share in Part B. All right, next is Medicare Part D. This is your prescription drug coverage. Now, in your prescription drug coverage, there again, this is one, by the way, as I mentioned with Part B, that's usually paid, deducted right from your Social Security. Part D, you have the option. You're actually getting that through a private insurer, but you're going to have the ability to choose from that, in other words, compare prices with different carriers. So it can vary a little bit. You want to configure at about $30 a month for that, give or take, for a Part D. So, and then you're still going to have deductibles and coinsurance. There's a thing called a donut hole where you reach a certain cap, then there's no coverage, and then coverage picks up again. So your out-of-pocket cost, depending on prescription costs, I've got people that come into my office that are paying literally, and this may seem crazy if you've never had anyone that you know of or you've not experienced yourself, literally $10,000 a month for one prescription. okay, that they absolutely need, okay, this isn't an option. So prescription cost to them is extremely important, and how to cover that cost to minimize that is so important as well. So Part D for them is going to be really important, but they're going to have still a lot of out-of-pocket. Nothing like, of course, at $10,000 a month, right? Think about that. My goodness, that's like $120,000 a year. So you know, these are the kinds of things planning for in retirement that you need to know. So let's take a look at the next one on option 1, Medicare Part D prescription drug. So let's break, that's that donut hole I was talking to you about. So the monthly premiums, again, it can vary according to the carrier. The annual deductible also can vary. Copays 25%. That coverage gap, that donut hole between $3,300 and $7,000. So you got about a $3,700 potential out of pocket just on that part alone. And then after $5,000 is out of pocket, then you've about 5% copay after that. So again, $5,000 a year, depending on type of prescription coverages that you have. How are you going to cover that? We're going to talk about these two things, all right? Because that's where we get into where the options come in. Okay, Medicare sub. So you got A, B, and D. Okay, hospitalization, outpatient, and your drug coverage. Now we got there's Part C or Medicare supplement. Which one are we going to take? All right, which one's going to make most sense? Medicare supplement plan is going to be is basically to help cover those deductibles and co-insurances that are not covered under the first, under A, B, and D. All right, however, it provides no prescription coverage. So that's one of the differences with Medicare supplement plans. Medicare Advantage, which is also known as Part C, there you can get prescription coverage, and depending on what you're going to be dealing with as to what that cost is going to be. In other words, now we got to shop plans. With Medicare supplement plans, there are 10 different plans to choose from, okay, all with differences. You may need some help with this, okay? It's really complicated. The next is on your Medicare Part C, same thing, lots of choices, lots of differences, so it's important to understand the difference, and I'm going to help you with that as soon as we return. But first, a quick break. Join us here. We'll be right back on the Retirement Report.